All right, student. So now we're going to talk about our next chapter, which discuss coordinating care for clients with infectious um, respiratory disease. Okay, a client with infectious respiratory disease. Next slide. All right, so introductory is the body function requires constant oxygen supply, right? It does, right? There are a series of complex, comprehensive, and efficient protective and defense mechanisms against harmful pathogens for both the upper and respiratory tract. And I believe we've talked about some of those in our previous chapter. So the respiratory tract, again, maintains a persistent interference with the external physical environment, resulting in a high degree of direct exposure to microorganism, right? And the tract is a common site for infection by pathogen, and I guess you can see why, right? Next slide. Upper respiratory tract system. What you see is surface epithelium, which secretes the antimicrobial peptides, right? And so these pathogens can produce a lot of infection within the tract, right? And some of these pathogens include bacteria, viruses, and fungi, right? As environmental air is inhaled, right, the first line of defense take place, and that lies within the upper respiratory tract. And there you have the nasal cavities, the pharynx, and the larynx, right? And you have endothelial linings. They have like some hair-like projections, right? These are cilia, right? And they have like a wave-like motion to help transport any particle that is trapped by the mucus, right? So the mucus itself forms some type of protection, right, back into the nasal pharynx and the oral pharynx. So for you to cough it up or bring it out, right? This mechanism is called the mucociliary escalator. Makes sense, right? To remove. And when fluid, in food, and fluids are swallowed, right? Because the two pipes are not the same. But what happens is, as part of our protection, you have the epiglottis closes, right? That closes, right? To allow and prevent aspiration. Because if it's open, then things are going to go into the airway. So that would help prevent aspiration, right? So no gastric content can get into the airway, right? So this additional protective mechanism that we have is the colonization. So you have like a number of bacteria small enough that do not cause an infection that colonize, right? To help protect us, right? Next slide. So the lower respiratory tract, again, the trachea marks the beginning of the lower respiratory tract, along with the bronchi, the bronchioles, and the alveoli, right? Should any pathogen gain access to the lowest portion of the respiratory tract, alveolar macrophages are the most important means of eliminating this microorganism, right? So it's really it's usually considered a sterile place, right? But if any bacteria invades it, then it has its own protective mechanism to try to remove them. All right, next slide. All right, so for examples of again, resident bacteria and viruses that are usually there as a protections are Staphylococcus, Streptococcus, Mycobacteria, Protos, and this is considered normal flora, right? Those are called resident bacteria. They're there. Again, their function is to maintain a healthy respiratory status by competing with pathogens for attachment site, right? So this is my place kind of thing in the respiratory mucus lining, and they produce bactericidal substances, right? So bactericidal kills, so what they try to do is to destroy harmful organism. All right, Next slide. So let's talk about one of the infectious condition, influenza. Influenza, they are highly contagious infection that spread rapidly, right? And there's three types, A, B, and C, right? There's some outbreak of influenza. These are tracked by CDC, Center for Disease Control and Prevention. The extent and severity can vary among the different areas that we have throughout the United States, right? So influenza type A, so here you have a virus that's divided into subtypes based on the differences in the viral proteins that they have, viral protein H and viral protein N, right? Influenza B is not broken down into subtypes, but can be categorized by different strain, right? Influenza A and B are responsible for the epidemic, endemic that we see in most respiratory illnesses that occur most during the winter months, right? So you see a lot of that during the winter months and often associated with the increased hospitalization and death, right? So that's influenza A and B. Influenza C typically cause either no symptoms at all or just very mild respiratory illnesses. All right, and then you have fomites, which are inanimate objects that carry organism and facilitate their transfer from one person to the next. So an example of fomite that the nurse carries will be the stethoscope, right? And then you have pens and you have scissors. So it's important for you to know those definitions of things. All right, next slide. So what are some of the clinical manifestations that you'll see with influenza, right? So again, the flu are more severe than those of a cold, and they come on a lot more quickly. So cold is more, it's not as severe. So some of the manifestations include fever, headache, sore throat, severe nasal congestion, cough, malaise, muscle aches and pain, and malaise, right? And fatigue. So in management, in emergency department and outpatient setting, the most commonly utilized test for influenza, that is used is called the rapid influenza diagnostic test, right? It helps to identify the influenza virus that can be made in less than 30 minutes, through a swab, right? So what is the medication? Well, because it's a virus, you can't use antibiotic. But since most influenza are also mild, so we just are trying to treat the symptoms. So antipyretics, analgesics for fever and aches, and then of course adequate a lot of fluid intake to avoid any type of dehydration, and rest is usually the prescribed remedy. All right, next slide. So the next one condition is pneumonia. Pneumonia can be, it occurs at any time, at any age. Individuals who are immunocompromised are more at risk. So you see about 3 to 4 million cases that are reported annually in the United States, right? And 1/3 of these occurs in people over 65, right? So individuals over 65. Pneumonia is classified into different types, so community-acquired pneumonia, and you have methicillin, staphylococcus aureus, community-acquired pneumonia, or hospitalized acquired pneumonia, and healthcare-associated pneumonia. So those are the different types, right? And so pneumonia caused by some atypical organism is often associated with mild respiratory symptoms. So pretty much the pathophysiology is that the organism enters the respiratory tract through inhalation or infected droplets or aspiration from the oropharynx, right? So they invade the protective mechanism that we talked about of the respiratory tract and then initiate the inflammatory process. All right, next slide. So the figure that you're looking at is showing the localizing or diffuse pneumonia, A, right? And then the right lower lobe pneumonia, and B is what you see is diffuse pneumonia. Next slide. So the manifestation of pneumonia. So As a nurse, you should be aware of the clinical manifestation and the predictors of increased mortality is essential to help ensure a steady identification and treatment. So some of the manifestation that you'll see are fever, chills, fatigue, tachypnea, dyspnea, tachycardia, and a cough. The cough can be productive or non-productive. Pleuric chest pain, myalgia, and arthalgia, right? And in terms of treatment, if it's bacteria, then of course you want to use antibiotics and making sure that there's a sensitivity test. Bronchodilators with albuterol or Combivent can be used. It's delivered either by aerosol nebulization or by metered-dose inhaler, would help to open the swollen and narrowed airway, which would help promote the ease, right? Promote ease. So some of the complications that you will see is methicillin resistant Staphylococcus aureus community-acquired pneumonia, which can lead to other necrotic bacterial pneumonia, which would also result in further hospitalization or prolonged hospitalization. Next slide. All right, and then the next slide is we're talking about TB, right? TB is potentially life-threatening, respiratory infection. It is caused by organism, tuberculosis, right? There's reported of 9,421 new cases of TB in the United States in 2014, right? Which represented a decline in it's about 1.5% drop from 2013. The population living outside of the U.S. and individuals that are lower socioeconomical groups, and those people that don't have access to health care, and you see that in racial and ethnic minorities have the highest incident of TB. TB is disproportionately, affect the blacks, Hispanics, and Asians. All right, so you see more in the minorities than the majority. TB is also a pertinent, persistent problem that you see in individuals that are homeless and the incarcerated population as well, because crowded areas, you tend to see that. So the pathophysiology is pretty much so you have the active tuberculin bacilli, after a close contact situation, those whose sputum is affected, right, because it has to be, with the TB are most likely to transmit it. So it's transmitted through inhalation of it. So this is why when someone is diagnosed with TB, we have to protect the rest of the folks by putting on a certain mask, right? Next slide. All right, so TB, there's some classifications of it. So there's latent, there's primary progressive, and then there's drug-resistant TB. So for the latent TB infection, it's usually seen in individuals with intact immune system, but have limited further proliferation and spread of the mycobacterium. Individuals that have a weakened immune system are unable to control the multiplication of the TB, right? So that's why these guys, even when you're testing for TB, for individuals that have immunocompromised issues, their diagnosis, it's a different results for the skin testing. All right. So those that have the drug-resistant TB, and it's usually, this is one of the reasons why the drug treatment is utilized, multiple different types of drug to help alleviate the drug resistance. So more than one drug is usually used to treat the actual case instead of just one to help alleviate the drug-resistant TB. So how do we know that someone has TB? So there has to be some diagnostic test. So laboratory testing consists of sputum test for culture and acid fast staining. So prior to that, chest X-ray can confirm, right? Chest X-ray can confirm active case, But we want to first do a skin test, right? So a skin test that is positive purified protein derivative (PPD). That's the Mantox test. So that would tell us if someone was exposed. And so what you do is you want to see the result. Is the person active? So a positive TB test is one that the TB is given. The test is given at 15 degrees intradermal, right? And you ask the patient to come back within 48 to 72 hours. And when they come back, what we're looking for is in duration, not just redness. So there's a raise. So it is positive for individuals in the general population that don't have any risk factors for TB at 50 millimeter. Those individuals at risk will be at 10. So who is at risk? You have healthcare workers, you have individuals in homeless, you have incarcerated individuals. So for them, positive TB test is 10. And then people that are immunocompromised, their result is positive at 5. So the AIDS client, or HIV client, their result is it's 5, right? So treatment is pretty much the goal is to, 1, to cure the client, 2, to minimize the transmission of the TB to other people, right? Because it's respiratory isolation. So to cure it, there's multiple drugs that can be used. And these drugs, there's streptomycin. With those type of drug, you have to worry about the the toxicity of it. So you have nephrotoxic, ototoxic. But also another drug that can be used is isoniazid, and usually when you're treating TB, it has to be multiple drugs. Isoniazid is one of the main drugs that is used. In addition, others are used with that. With isoniazid, you have to monitor for some of the complications of it, so hepatitis and neuropathy. So because of that, the client has to be seen at least frequently, if not every month, to monitor the liver function. And also for the neuropathy, to help alleviate that, they're taking vitamin B6 with that. And also other drugs that are used are ethambutol. That you have to be concerned about, optic neuritis, so any visual problem. You also need to, rifampin is also used with rifampin, because with TB drugs, the issue is you want to make sure that the patient is compliant. Rifampin discolors bodily fluid, and so you want to make sure that you tell them that, so that your urine, your sweat, all your bodily fluid is going to be discolored. So it's important, to do so. And the patient is again put in isolation, and they have to use the iron 95, so negative pressure room. The nurse has to put a mask, and the mask is not just a regular mask that it's not a surgical mask. It has to be fitted to make sure that the healthcare worker is protected against the TB. Okay? So that's ending the section of our lecture. And one thing you need to remember is, okay, so now the data you need to collect. Remember the assessment, we're talking about finding about travel and history, finding about a cough, because the cough or an active case of TB, they may have hemoptysis, night sweat, so those are the constitutional symptoms, weight loss, and the nursing diagnosis, so ineffective therapeutic management, knowledge deficit. So kind of sit down and say, okay, based on what is happening here, what kind of diagnosis that we need to have. The TB, remember we said that the older person, 1/3 of them have pneumonia, so there's a pneumonia vaccine that they need to get, and to make sure that they have it. So the primary prevention, to ensure that they are safe, the flu, so make sure that they take flu. The flu vaccine comes in 2 forms. There's a live virus and there's a dead virus, and so you want to probably make sure that those who have a weakened immune system, definitely not to get the live virus, is in the form of the nasal spray. Okay? All right, so that ends this lecture.